Dr. Tannan, thank you so much for having me. I love your office.
Thank you. I appreciate it. We're really proud of it. It's our all-female vibe here at Tannan Plastic Surgery.
Yeah, tell me a little bit about Tannan Plastic Surgery.
So I'm a board-certified plastic surgeon, and I specialize in all things aesthetics, so face, breast, and body. And I have a nurse injector who works with me and who also partners with me doing the non-surgical side of things.
I know so many women watching today look in the mirror and they notice changes that they didn't expect. What do you say to women who come to you and are like, I just want to look like myself again?
I would say, number one, that's great, and we can do that. We just have to figure out what your goals are, and it helps to understand and highlight your aesthetic strengths, so like your beautiful eyes, your cheekbones, and then let's focus on that and have everything else frame around it. And it's different. It's a different approach for different ages.
I want to talk about injectables like toxins and fillers. Can you break down what each one actually does?
Toxins like Botox or Latibo, those are injectables that we inject, and they work where we inject them by paralyzing or weakening the muscle depending on the dose injected. So you'll see people use that often for the wrinkles around their eyes or their forehead. Whereas filler is something that we're going to place in areas where we know that you're going to have volume loss. As we get older into our 50s and 60s, we lose facial fat and some of the cheekbone, the actual bone structure recedes back. So filler is what we use to volumize there, within reason, of course.
We talk about women with darker skin tones who may be told that certain treatments aren't for them. How do treatments like laser or microneedling need to be adjusted for women with deeper skin tones, and how should a woman evaluate whether her provider has the right expertise?
For things like laser, microneedling, those are addressing the whole canvas, whereas injectables, we kind of target specific areas. And one of the cells that live at the very top of that canvas are our pigment-producing cells. So we have to make sure to calm those down so that they're a little bit more senescent or not producing active pigment while they're getting the treatment. And that comes with prescription medications and experience. So every patient who's investigating, trying to find a provider for them, should interview their providers, ask about their experience taking care of women of color, and what is their approach? How would they tailor it? Which, in our practice at Tannan Plastic Surgery, we decrease the trauma caused by the microneedling and the laser over and provide the treatment over a greater number of sessions so that we can keep our patients safe.
Now, how does someone know if they're ready for plastic surgery?
The nice thing about being at a practice where you work with both plastic surgeons, ENT facial plastic surgeons or dermatologists, and the injectors is they know their expertise and they know what's outside of their expertise. So here, for example, my nurse injector will say, Dr. Tannan, there's not much more I can do. I've done a lot of laser resurfacing for her wrinkles, but now it's time for the lift. So having providers that partner with each other allows us to do a more comprehensive approach.
I want to talk about that term facelift, which can sound very scary or extreme for some people. Can you paint us a picture of what the modern facelift actually looks like?
The modern facelift is tasteful, it's natural, it's not overdone. It's that you want someone to just like, oh, did you get a new face cream? Like that is, to me, a successful facelift. When you go to a reunion and people are like, wow, you just look so good. You look radiant. But they're not going to you and I need to know your surgeon. Do you know what I mean? And so it can be scary, but that's why you need to interview different providers, find the right fit for you, and look at their before and afters, understand their philosophy, explain what your goals are, and make sure that they're able to meet you in the middle.
For the woman who may be watching right now, who may be curious but hesitant, what would you say to her directly?
I would say now is a good time to learn. You can go to our website, you can go to our social channels. I just recommend learning from doctors, healthcare providers, nurses who are injectors, for example, rather than just going on the web. It's important to get targeted, accurate information from medical providers rather than just getting your answers from AI, for example. And you take care of yourself. You get your hair done, you do your makeup. Think of aesthetic treatments as an extension of that. It's not just for celebrities, it's for regular people like us.